it's not as important how the person got that way as the way they are. So I want to know how the person's mind works and really how their heart works too. If they tend to skew in their view of things, and we know from studies that you show neutral faces to borderline patients, so they tend to see negative expressions, it's much more important that the patient become aware of that, think about it, and move beyond it than to say, oh, you got this way because of X, Y, or Z, which doesn't really change anything therapeutically anyway. But the trauma issue is quite significant because even though trauma, of course, is a horrible thing, if we see trauma as the sole or central problem, I think we miss out on some other important aspects of the personality. And one of the unfortunate parts of trauma is that it makes it really hard for a person to have a healthy acceptance of their own aggressive side, which is a normal side. One of my patients banged her fist on the chair and said, "I'd rather be dead than think I have anything in common with that father who abused me." And I said, you just defined the problem. You'd rather be dead than think you have anything in common. We can probably assume you have something in common with him. Nobody's pure. Nobody's free of anger and aggression. But if every time you feel the slightest anger or aggression, you think, that makes me a horrible, traumatic abuser, then you can't allow yourself to be in touch with parts of you, and that's both inhibiting your growth and making life very difficult for you. So a trauma history can make it especially hard to integrate one's own aggression.